Hi, I am Dr. Vivek Rege. I am a pediatric and neonatal surgeon. Today I am talking to you about a common problem in children, which is tongue tie. In tongue tie, there is a very short frenulum, or as I call it, jaban ko lagam hote hai, and therefore the tongue is not being able to be protruded out. Now, how does this affect a child? In the newborn period, there is no problem about having a breastfeed or any other outside feed. Sucking, swallowing, everything is perfectly normal. And therefore, there is no need to panic if it is picked up also that you need to undergo surgery at newborn stage or anything. We can wait till the child is older. Now, what exactly is the problem with tongue tie is that as the child starts speaking, the hard consonants like t, th, th, these are difficult to pronounce because there is a inability to hit the palate with the tongue because it is held down by the short frenulum. Now, the reason why we need to do the surgery is because if we do not, often as the child grows and starts speaking, the child may start having a lisp. So instead of saying tata, he may say tata. So that is the reason why it needs to be done. That is one. And the other reason is after we eat food and when we have teeth, etc., normally you clean the back of your teeth with the tongue, which again cannot be done in a child with tongue tie. For these two reasons, we need to operate and release the tongue tie. Now, this is a very short procedure. It can be done on a daycare. That means you come in the morning, you can go home in the same evening. There is no problem. We just cut the frenulum which is shortened, which you will see in the pictures. And once that is done, we have released the short frenulum. The tongue can be protruded outside. But after surgery, we always keep the child only on liquids for the next 3 to 4 days because any solid can hurt where we have cut and sometimes we have stitched, so that there should not be any bleeding, and therefore we advise for 3 to 4 days only liquid diet. After 3 to 4 days, then we start on semi solids, then on solids, and then the child is on perfectly normal. Now, what is the correct time to do this? Roughly before the age of 1 year, before the child starts talking, before the child starts pronouncing wrongly, that would be the ideal time to get the tongue tie released. This does not recur. It does not cause most of the any major complication, if at all. Sometimes there is slight amount of bleeding from where we have cut because it's a raw area. Other than that, there should not be any problem. The child can go home the same night after the surgery and follow up with the doctor later on. And therefore, recurrence, complications are all not there. And therefore, this is a very simple problem but needs to be tackled, not too early, neither too late.